Depression is more than sadness. When most people think about depression, they think about sadness. But what if I told you depression often looks like exhaustion, body pain, headaches, irritability, poor sleep, or feeling emotionally numb? As a mental health nurse practitioner, one of the biggest things I wish people understood is this: depression doesn't always cry. Sometimes depression hides. And today we're talking about the real face of depression that many people miss. Depression is one of the most common mental health conditions in the world. Millions of adults experience major depression every year. Women are affected at higher rates, but men are often underdiagnosed because symptoms may look different. And here's something important: depression is not just emotional, it affects the entire body. People with depression often experience fatigue, chronic pain, sleep changes, appetite changes, difficulty concentrating. In fact, many patients don't even come to appointments saying, "I think I'm depressed." Instead, they say, "I'm always tired, my body hurts, I can't focus, I feel off." The physical symptoms nobody talks about. One of the biggest misconceptions about depression is that it's only emotional. But depression has physical symptoms too. Common physical symptoms include headaches, chest tightness, back pain, stomach issues, body aches, fatigue, sleep problems, and many people spend years treating physical symptoms without realizing depression may be underneath it all. Depression and pain actually share overlapping pathways in the brain. That means emotional pain can literally become physical pain. And unfortunately, when depression presents physically, it often goes undiagnosed longer. That's why screening matters. Depression is not weakness. Let's clear up one harmful myth. Depression is not at all a personal weakness. It is not laziness. It is not lack of willpower. And it is not a character flaw. Depression involves brain chemistry, stress hormones, genetics, trauma, nervous system dysregulation, environmental stressors. Would you shame someone for having diabetes, high blood pressure, asthma? No. Depression deserves the same compassion and treatment as any other medical condition. And stigma keeps too many people suffering in silence. Why early treatment matters. Untreated depression can affect relationships, careers, physical health, sleep, self-esteem, and quality of life. It's also linked to heart disease, chronic inflammation, diabetes, dementia, and increased suicide risk. The good news: treatment works. That treatment may include therapy, medication, exercise, lifestyle changes, support systems, stress management, and healing takes time. Depression treatment is not always instant. Sometimes it takes adjusting the treatment plan, but improvement is possible. If nobody has told you this lately, you are not weak for struggling, and asking for help is not failure, it's strength. If this video helped you understand depression differently, like this video and subscribe for more mental health education and wellness content. What's one thing you wish people understood about depression? Remember, healing is possible, and you do not have to go through it alone.